Hi, my name is Misty Fitzgerald and I'm currently attending Southwestern Community College. Today's speech is the informative speech, and today I'm giving my informative speech on sleep apnea. Hello, my name is Misty Fitzgerald and today I would like to talk to you about sleep apnea. So sleep apnea is a potentially serious sleep disorder that occurs when a person stops breathing and then restarts breathing repeatedly throughout the night. There are three different types of sleep apnea. You have obstructive sleep apnea, central sleep apnea, and complex obstructive sleep apnea. According to the website www.mayohealthclinics.org, signs of sleep apnea include but are not limited to excessive daytime sleepiness. So if you feel like you're not able to stay awake at school or work, even though you had a good 8 hours sleep the night before, that is one sign. Another sign, of course, is if your bed partner witnesses you stop breathing while you're sleeping and has to nudge you in the side and wake you up or get you to roll over. Another symptom or sign might be if you wake up gasping for air, wake up feeling like you're choking, or feeling like you do not get enough air while you're sleeping. Another article that I read entitled "Finally a Good Night's Sleep" by Alice Oglethorpe states that men, women, and children can be diagnosed with sleep apnea. Yes, it's common that older men that are overweight get diagnosed with sleep apnea, but women that are going through menopause or postmenopausal are at increased risk for sleep apnea as well. Children can be diagnosed with sleep apnea. A child with ADHD may be tested for sleep apnea because if they do not sleep well at night, they may portray some of the signs of ADHD. Another thing with children, the physician needs and will check to see if their tonsils are enlarged, because if their tonsils are enlarged and touching, then they may stop breathing because of the enlarged tonsils as well. So the two different ways that we can diagnose sleep apnea is with a home sleep study and with what we call a nocturnal polysomnography. A home sleep study, the patient comes in, we show them how to hook up a home sleep study, they take it home, they put it on, and they test themselves at home. The nocturnal polysomnography is done in the lab where the patient comes in, they're hooked up to a bunch of wires, and we watch what stage of sleep they're in, what their heart is doing, how many times they stop breathing, and how low their oxygen drops. So there are several different ways that we can treat sleep apnea. There are three different machines, actually four. The first one is a CPAP machine, the second a BiPAP machine, the third is a BiPAP ST machine, and the fourth is what we call an auto servo adaptive ventilation. Mild to moderate obstructive sleep apnea is treated with a CPAP machine. Your moderate and beyond is treated with a BiPAP or an auto servo adaptive machine. So if you feel like you or a loved one may have the signs or portray the signs of sleep apnea, please go to your doctor and be tested for sleep apnea. It may reduce your risk for a heart attack, stroke, or even possibly death. Thank you.